But I got this. I'm going to stay positive. It's going to turn out okay. And cancer. I'm telling them about this blood because something's wrong that's not normal. There was no pain with urination. There was no other symptom, but just blood, and quite a bit of it. Got news I didn't want to hear today. I don't make a lot of content or videos on here, but I'm going to share this journey. Diagnosed with bladder cancer today. That should be discussed unless it's an absolutely necessary course of treatment. So cystoscopy is done. Everything looks clear. What I get a lot is that people describe me as being strong. I'm divorced. I've raised kids on my own. I've survived cancer, domestic violence, a lot. And I just don't let it stop me or slow me down. Or I mean, I've looked at everything that's happened to me as an opportunity for learning and growth. Blood in my urine. A significant amount of blood in my urine. Yeah, like, I mean, a lot. And I have recurrent sinus infections also. And I had just made a visit with whatever provider was available at my doctor's office to get in right away for a sinus infection. And the assistant that was checking me in, I knew her from my primary provider, and she was just asking how I'm doing. And I said, it's just another sinus infection. I said, but there's one other thing. I said, there's a lot of blood in my urine. She said, oh my gosh, let's get you into the bathroom. I'm going to set you up. We need a sample. Like she right away did everything she needed to do. And then when the provider came in to talk to me, I've never met him before. And he tried to explain to me that I wasn't really seeing blood in my urine. It must be something I ate. And I'm like, I'm 59. I've had 5 children. I think I know very well what blood looks like in the toilet. For instance, if a woman was on her menstrual cycle and you see the blood in the toilet, it was like that. It was a lot. It was significant. It had started with just a tiny spotting, and which kind of got dismissed as, maybe possibly a UTI kind of thing. And I may not be remembering clearly, but I thought I was given a round of antibiotics, and then it just kept increasing. And I just happened to also be sick and wanting to be seen for that sinus infection. And I'm like, okay, I'm telling them about this blood because something's wrong that's not normal. There was no pain with urination. There wasn't any pressure or, there was no other symptom, but just blood, and quite a bit of it. My initial appointment was with the PA in the urologist's office, and we discussed what was going on, and we did the urine tests and everything. And they sent the urine off to check for cancer cells. And they called me back and said, this is really great news. There's no cancer cells in your urine, but we still want you to come in and see the urologist, for this cystoscopy. And that was my first one. And then lo and behold, there's the tumor. I was sitting down and I was in shock. And I was actually texting my adult daughters. I was texting them from the office saying that I have cancer. Like, it's just something you see I don't know. It's that reality moment that happens to other people, but it doesn't happen to you. And then now it's happening to you. And so it was just, cancer's a really scary word. It's a scary diagnosis because the cancers that we see and hear about most often are don't always have good outcomes. And bladder cancer, I didn't even know it was a thing until I got it. I'd never heard about it. I had no idea that you can get cancer in the bladder. It was very surreal. It was very surreal. It was a lot of information to absorb. But I mean, I didn't cry. I didn't freak out. I just, and I really just credit my urologist for that, because he was just so good at talking me through all of it. And then I just felt like really confident that, okay, I get this procedure done, I do this treatment, and then I've done it. I've won, you know. It's uncomfortable, but it's manageable. It's you're taken back and into a room, and you undress from the waist down. For a woman, you know, your feet are in the stirrups, your privates are exposed. It's they use lidocaine at the opening of your urethra. That helps tremendously. And then it's like a catheter with a camera at the end. It's about the size of a catheter. They insert that scope through your urethra, and they can see into your bladder. For me, there is a TV screen right there. It's facing me, so I see everything that he sees. Everything was explained to me. Um, and it wasn't painful at all. It was very interesting. It was pretty fascinating, because it looks like, I don't know, it looks like a little sea anemone or a piece of coral. It's just got a funky shape, and it's just kind of stuck on the bladder wall, floating around in there. And it was very interesting. And even though seeing it and all of that stuff, and then he says, when he pulls the scope out, and then he brings in all the pamphlets on bladder cancer. So during the scope, he didn't actually say, that it was cancer. And so that reality, it was a little bit of a delayed reality for me, and my reaction to it, I credit him for my reaction to it, because he was very, his bedside manner was outstanding. And he was very confident that, this is what it is. We're going to remove it. And then we do this treatment, and you will 100% be fine. He kept telling me I would be fine. You are going to be covered. And he was just so confident. And I felt, I just put my trust in my urologist, and he's amazing. I had to get the surgery scheduled like ace. And here's me not taking things very seriously. I said, well, can I wait till school's out? Because I'm a paraprofessional. And so I said, can I wait till the school year's over? And then we can do it, because I'm off for the summer and I don't have to miss any work and stuff. And he said, no, this has to be done like now. It has to be done ASAP. And I said, oh, okay. There really wasn't any options. It was the TURBT surgery, the TURBT surgery, and then immediately into explaining the BCG treatment. Yeah, I had my first BCG in June of 23, and it was probably by January of 24 is when I started getting like, I don't want to do it anymore. And by September of 24, I said, I don't want to continue the maintenance. Just had my 90-day cystoscopy, since I declined BCG treatment to continue for my maintenance treatment for bladder cancer. Still no signs of cancer. The big thing for me is for my doctor, my urologist, he listens to me. And I feel listened to, I feel heard, and I provide him with that same respect and listening to him, because he's the expert, obviously, in the treatment plan. But he really I felt that he listened to me, and he understood why I wanted to stop the maintenance treatment when I did. And we discussed what that would look like in the future if there's a recurrence. It was during all those treatments, those visits, once a week, and then you get a break, and then you go back for your maintenance treatment. I just finished my second round 3-week maintenance treatment of BCG at half strength. There was a time where I was in a very negative headspace. And I told them when I went to my appointment, I don't want to be here. I don't want to do this anymore. I'm done. I'm over it. I'm here because I know I have to, and I know this is what's best, but I don't want to do it anymore. And I did get, I don't know, maybe a little depressed about it. I mean, I was sick and tired of having medication put into my bladder. I was tired of undressing from the waist down. I was tired of putting my feet in stirrups. I was just over it, the whole experience. BCG, it was 6 weeks. You go in once a week for 6 weeks for your initial treatment. And that's a lot. In December, I did have that intravesical chemotherapy, and they did it through a catheter. They inserted it through a catheter. It's a liquid, and then they clamp it, and it's held in there for an hour. And then when they pull the catheter out, and then because that was all done during the day surgery that I had in December, so I've only had it the one time. I don't think that should be an option unless it's absolutely necessary. Like, is there been like multiple recurrences, or is it invading the muscle now? Is it growing? Is the cancer it? But for me specifically, I had non-muscle invasive cancer, and so I mean, why would I do that? That would just be, to me, that would just be the extreme, the have to situation. Like, it's my life or the bladder. Obviously, I'm going to choose my life because I want to continue to have a good quality of life. But I don't think that should be discussed unless it's an absolutely necessary course of treatment. They definitely need to be open-minded and explore the new options that are coming out. Like, what treatment can improve the quality of life for my patient? What's going to give them the less, difficulties? Like, what's going to interfere the most and what's going to interfere the least, as well as being effective? Because think about their lifestyle, think about who they are, their age, their activity level. What do they do for a living? What do they do for recreation? There's just think of their whole quality of life and really focus on that. And like, what are the options? What can we do that's going to be the least impactful in a negative way? That's what I want medical professionals to think about. Is we are human beings. Yes, we are a patient. Yes, we have this condition or this cancer, and yes, you are the expert, but we also have a life outside of our condition. If it's medically necessary, then of course I'll do what I have to do, because I don't know. Bladder cancer has a high recurrence rate. So, I mean, there's always the chance that it comes back for me. And so knowing that there's advancements and a variety, new treatments or whatever, I think that's good news, and something that if I come to that with my urologist, then I can talk to him and say, what's available, what's different, what are we looking at here? The side effects and how that's going to affect my life, my ability to work and function. That's number one. And then, and effectiveness, because in the grand scheme of things, of course, I would like fewer side effects, but if something's not going to be as effective, then I'm going to have to suck it up and go with what's most effective. I ask the questions, do the research. Even in December, when I had that growth removed out of my bladder, my doctor started talking to me about the intravesical chemotherapy and stuff. I started spouting percentages back to him about how that was going to reduce the rate of recurrence and stuff. And he started laughing. He was chuckling. And I said, I'm sorry. I said, but I did my research because I want to know. And he thought it was great. He was actually pretty impressed, in a comical kind of way, because I don't think he expected it out of me. But I said, this is good, and I'm okay with this because this is going to reduce my recurrence rate don't be afraid. Don't be afraid to speak up. Don't be afraid to ask. You are your own best advocate. And if you don't speak up, who's going to? That's we have to advocate for ourselves. You may have a caregiver or a spouse, a significant other, a parent, or in my case, I had adult children that were looking out for me. But people have questions, and jot them down. Make a note in your phone, in your notes app or something, or a piece of paper, and jot your questions down and your concerns down, and bring them up. Talk to your nurses, talk to your doctor, talk to everybody. They're a wealth of information. And I don't think, in my mind, I don't think that puts anybody in a negative light. And I think that we should be as informed as we can be.